Hi, my name's Caitlin. I'll be performing a chest drainage tube system assessment.
Here.
Okay, so hi, I'm Caitlin. I'm gonna assess your chest tube drainage today. Okay? Okay, great. Can I have your name and date of birth, please? Okay. 2 patient identifiers. Next, I would perform hand hygiene and don gloves. First thing I would do is check to make sure that the patient wasn't in any pain. Are you in any pain today on a scale of 0 to 10, 10 being the worst? No pain? Okay, great. Then I would go ahead and pull his blanket down, lift up his Johnny, and cover the patient back up to provide a little privacy. Then I would look at where the chest tube was placed. Then I would make sure it was still taped down and check for any redness, swelling, erythema. And then I'm going to palpate the area to check for crepitus, which will sound like crackles, which is trapped air underneath the skin. None of that is present here. At this point, I would check the line to make sure that there was no kinks and that the tube was attached all the way down. Some problems that might arise with the tubing could be excessive bubbling. The machine could be knocked over, could be cracked. The tube could be removed from the patient. If the tube was out of the patient when I came into the room, I would immediately take my gauze, rip it open, and cover the opening. Would tape it on 3 sides and call for help. And because the chest tube is sutured in, the surgeon would have to reinsert the chest tube. If I came into the room and the machine was tipped over and it had cracked, you want to make sure that you want to tape the machine down too, just to prevent it from being tipped over, and also you want to keep it below the patient to allow for proper drainage. If I came over and the machine was cracked, lots of bubbling would be happening here, and I would shut the suction off and call for help to have someone come and replace the drainage tube. Next, if I came into the room and the tube to the machine was not attached anymore, I would take my Sterile Water, make sure that it wasn't expired, also lip it if it was open, and pour some into the graduated cylinder, and immediately take the tubing and submerge it to keep that water seal. Also, upon inspection, I would check to see how much drainage was actually being removed from the patient. I would take a piece of tape and mark where the drainage was at 160. I would place the piece of tape, write my initials, time, day, and I would also document what the drainage looked like, what color the drainage was, and how much drainage there was. Also, another scenario that might happen with the system is there might be a crack in the tube or a leak in the tube. So at this point, I would take my Kelly clamps. Demonstration purposes, I'm going to use my fingers. And I would start as closest to the patient's skin as possible, clamping 1.5 to 2 inches apart, and moving down the tube 1.5 to 2 inches until I got to the point where the machine stopped bubbling. I would be able to find the tear in the tube. I would take my tape and tape up the hole immediately, and then call for help to have a new tube replaced. Also, I forgot to mention, if the patient was in any pain before assessing, I would check to make sure that I was able to administer pain medication, and then I would check back in 30 minutes to see how the patient feels and then reassess the chest tube drain at that time. I'm gonna make sure that the suction was on, and hand the call light, put the bed rails back up, lower the bed, and move on to the next patient. Thank you.